Thank you very much. We thank the organizer for inviting us to be part of this very important discussion. We have had all of it, the data, statistics, the tools at our disposal, what can be done. Very good example from my sister in Rwanda, where coverage is the highest in the world and on the African continent, but not one of the richest countries. So it's not always the question of resources. It's mostly the question of will and commitment. And where is will, there is a way. Rwanda has just demonstrated that. I don't want to go back in those, just to say that in Namibia we stand at about 18% incidence of cervical cancer. We haven't done that much, but we are on the road, like Michelle has indicated. We integrate our program for cervical screening, knowledge transmission, and care together with HIV. We believe that's the best approach under the circumstance. We also give the responsibility to community health care for early identification and bringing people into screening program. There are some opportunities we missed, such as the one that was offered by PEPFAR through the red ribbon, pink ribbon, but we're now trying to recapture some of these lost grounds. Yesterday alone, I was in Heidelberg, and I see Dr. Bushman here, where we're trying to sign a memorandum of understanding with the German Cancer Research Institute to help us strengthen our cancer care program, including cervical cancer, with research, emphasis on research, data collection, and knowledge transmission, which is already taking place in Namibia. It has been a challenge to reach as many people as possible. And we believe it can be done if we strengthen community health cares. We have heard from Heidelberg yesterday that there are now novel tools coming up. For instance, a new HPV vaccine that is heat resistant. We know in Africa we don't have fridges in villages. So we look up to these innovative discoveries. And as well, things like where the person can take the swab herself and send it for diagnosis instead of coming to queue up in health facility. We hope this memorandum of understanding between us and Heidelberg Group will come forth to assist us to strengthen our capacity, not only at primary healthcare for screening, but even curative. I've just related to them that we have a problem of only having one cobalt-based radiotherapy machine for a population of 2.3 million. These are some of the challenges that we're sitting with. We also think that we can still engage Gavi and perhaps Unit 8 to still work with us and support us, despite the fact that Namibia is an upper middle income country in terms of World Bank classification. We do not necessarily want just to look at the gross domestic product, but to look at the population that is affected by diseases. And we believe together we can go a long way to eliminate cervical cancer and maybe other NCD as well. So I thank you.
Thank you so much, Honorable Minister.